Hello and welcome. We're delighted to be hosting our final Kidney Care and Living Donation Scotland webinar of the year. And this one is focusing on children and young people. Just to let you know that this webinar is being recorded and there should be a note on your screen. If you have any questions, we're going to keep all the questions to the end, but just put them in the chat bar and we can make sure that the panel can answer as many as possible at the end of the sessions. Maybe just to start with, just so we know who's all joining us, if you could just put in the chat bar where you're joining us from, and that gives everyone an idea of the geographical spread. Can you see in the chat? And then they've got the questions and answers for the question and answers at the bottom of your screen. Lovely, thank you very much. So I'm delighted that we have got Paul Bristow with us tonight. Paul is the Chief Executive of Kidney Care UK, and he's joining us to say a few words to the group. Thank you very much, Paul. Thank you.
Thanks, Jen, and a very good evening to everyone. And thank you so much for giving up your time to attend what I know will be another informative and enjoyable session. I'm particularly proud to join the one about children and young people because many of you might know the charity itself was formed by a mother, and our heritage goes back a long way supporting children and young people. This is the last webinar in 2021 in a whole series of webinars that's been run by Kidney Care UK in partnership with Living Donation Scotland. And I couldn't let the last one go without stealing just a few minutes to say a big thank you to everyone. I don't think the need for webinars has ever been greater than the last year or 18 months we've had, with isolation, anxiety in the communities, disruption to act that does cause a lot of worry with patients. And I think these webinars are a fabulous way of connecting the community and giving people a chance to get some clarification about some of the information that gets put out that perhaps isn't as clear as it should be. But an awful lot of work has to go on to make them happen. And really, the reason I wanted to join is just to say a huge thank you to every speaker, every organizer who's put so much effort into bringing these to life. I do hope these webinars have played just a small part in helping clarify matters and informing people about what's going on. But I especially wanted to thank Jen and the whole team at Living Donation Scotland, because I think when two organisations are collaborative by nature and they come together to work together, I think they can make a bigger difference than they can on their own. So enjoy tonight. Thank you very much to everyone who's put so much effort into doing this. Thanks, Jen.
Thank you so much. And I must echo the words about two organisations working together, because it really does, it works particularly well. Thank you. So I'll go on now to our first speaker. We're delighted that Dr. Ben Reynolds can join us. Dr. Reynolds is a consultant nephrologist in Glasgow, and he works very closely with other healthcare professionals in Scotland to promote living donation, and he's going to give us an overview of our childhood kidney disease. I can hand over to Ben. Thank you very much.
Thanks, Jen. So as you can probably tell, I am not Lynn Cunningham, despite what it says at the bottom of the Zoom screen. So I am Ben Reynolds, one of the paediatric nephrologists based in Glasgow, and very kind request to come and speak to the group, really just to provide a very, very brief overview of kidney disease in childhood, and thinking about how we provide things in Scotland. I assume I just have to ask for my next slide to come along, and things will progress. Fantastic. So just as a brief overview of who we are and what we do. So we have a national centre based in Glasgow. And from Glasgow, we deliver hemodialysis to all children and young people who require it in centre within Glasgow itself. We also coordinate our home dialysis service from Glasgow, so those children and young people on peritoneal dialysis, and our small but elite cohort on home hemodialysis. We offer renal transplantation. We're the only hospital in Scotland that offers paediatric transplantation, and so that is all based in Glasgow as well. And we've recently successfully been commissioned by the Scottish Executive to provide complex inpatient care. And the way that things are organised in Scotland is that all of the nephrologists are based in Glasgow, so a team of 7 consultant nephrologists and our wider MDT members are all based in Glasgow. But there are also professionals across the whole country in each local region with their own local MDT and spin doctors, which sounds more dubious than it is, but special interest in nephrology paediatricians who have an interest in nephrology but are not quite full-time nephrologists. And each one of us within Glasgow then have our own patch of the country that we will go and visit on a regular basis, according to how many patients there are there. So patients hopefully get care delivered to them as close to their home as we can manage, but where it does need to be more specialist, then they come to Glasgow for that. Next slide, please. And just to give a flavour of how common kidney disease in children is, firstly, it is not common. There is not a need for large, huge services. Thankfully, it is relatively rare. So in the UK in 2019, we know that approximately 8 per million children under 16 started some form of kidney replacement therapy, whether that is started dialysis or had a transplant. And so that's the number, that 8 for every million children under 16 started that. And in 2019, 65 children per million under 16 had a transplant or were on dialysis. So these are small-ish numbers, but that's the tip of the iceberg, because of course there's lots more children and young people out there who have chronic kidney disease, stage 3, stage 4, stage 2, depending on the cause of their kidney disease, may or may not be more affected. And just as a quick feel for where we're at, we have 193 children at the moment who attend our chronic clinic, so have CKD stage 3 or worse. And we currently have 61 patients who've been transplanted who remain under active follow-up. And again, that is covering the entirety of Scotland. Next slide, please. So then thinking about why children get kidney disease, it really is very different from adults. The commonest cause for us, or one of the commonest causes, is that children are just born with bad kidneys. And that can either be something that's just affected the kidneys or is part of a wider genetic syndrome. The commonest cause, particularly in boys, is a blockage in the bladder whilst forming in the womb, some posterior urethral valves. And those children can be very variable from normal kidney function when they're an adult, right the way through to kidney failure at the time of birth. And we recognise that children who have bladders that don't work well are often at risk of damage to their kidneys over time. So congenital, meaning born with it, or structural disease is easily the commonest cause of significant kidney disease in children. That's very different to adults, who tend to have things that get worse over time. So diseases that affect your kidneys, such as diabetes or heart disease, that get worse over time. Children tend to be born with bad kidneys. Their kidney function may go down over time as the kidneys wear out, but the disease that's caused it in itself often doesn't. It's often static. So it's very different to adults. Sure, several people on this call will be familiar with nephrotic syndrome, where you leak protein. And in children, the commonest cause of that is steroid sensitive, where they get better with steroids, but steroids are bad for you. You have relapses, and we need to use other medicines to stop those relapses from happening. But usually the majority of those children have good function and go into adulthood with normal kidney function. But a smaller proportion will have steroid-resistant nephrotic syndrome, and sadly that is a very different category of disease. And our expectation is that over time those children will lose kidney function, and that is one of the commoner reasons for children to require dialysis and transplantation. And then as children get a little bit older and they start to move into the 9, 10, 11 teenagers, then they start to be at risk of the same diseases that can affect adults. So things called glomerulonephritis, easy word to say, particularly later in the evening. So things like IgA nephropathy, C3 glomerulopathy, membranous glomerulonephritis, antiglomerular basement membrane disease. That's why we use all these letters to summarize them, because they're often a huge mouthful to put out. So calling them GNs for short, but basically system diseases where your immune system is attacking the kidney in a variety of different ways. And then finally, and increasingly common, is where your kidneys have been affected by something, caused an acute kidney injury. So they've been attacked, they've been damaged by something. They get better, but they don't get better back to where they should be. And then you're left with significant kidney disease as a result of that. Common causes for that are, for example, heart surgery. So children born with very scrambled hearts need to have major heart surgery. 30 years ago, these children didn't survive that heart surgery. And now, thankfully, things are much better. But it does require you to stop the heart for a period of time. The kidneys don't get any blood supply. The children have a heart that now works well, but kidneys that don't work brilliantly. And so we're seeing more and more children come through from that. Survivors of childhood cancer, again, fantastic that children are surviving these ordeals, but their kidneys often don't survive quite as well as the rest of them. Next slide, please. So then thinking about some of the specific challenges that children with kidney disease have and the challenges that the professionals looking after them have. And there are things that are unique to children that adults don't do. And the big one is growth. Adults very rarely grow, although maybe a little bit around the middle, particularly in December, and then January we try to get rid of that. But hopefully most children grow upwards. And that's what we want. We want children to get sufficient calories, sufficient nutrition in. Sometimes that can be challenging, particularly if there's a fluid restriction, being able to get sufficient calories in. Everyone who has chronic kidney disease will tell you that food doesn't taste as good. Your appetite is away. You're more likely to be nauseated. And so lots of reasons why you just don't want to eat. And that is one of our greatest challenges. The second challenge is, of course, that then what you can eat can often be restricted. And then you have all the usual things that come along with children. Anyone who's ever had a 3 or 4-year-old will have the experience where for a month or 2 months or 6 months or 12 months, they only want to eat chicken nuggets and chips. And that's the only acceptable food. Maybe some Haribo as well. So if you have picky eating and then limitations on what you can eat, that can be a huge challenge. And we all recognize that actually the dietary management of chronic kidney disease is one of the hardest things for our families to deal with, and we would be lost without our dietitians. Children need medications. Patients with kidney disease often need various medications to supplement the job of the kidneys. And we are not particularly well served by big pharmaceutical companies, very much using what we see in the adults and then copying what they do and scaling it down for children. We are often using medicines that aren't licensed in children by necessity because there is no alternative. Crushing tablets rather than having child formulations available. And children don't like taking tablets because nobody likes taking tablets. But that burden can seem even more so when you are younger. Education and development is crucial, and we do try really hard to make sure that our kids get as much education as they can, but hemodialysis is a timely or is a time-consuming activity that most of us would rather not be doing. Being unwell impacts on concentration and attention. There is a deficit that's there. There is definitely an impact of renal disease on our children and young people that extends into adult life. Alex Hamilton, based in Bristol, carried out a SPEAK study looking at children and young people aged 16 to 24 and just compared them to their peers. Next slide, please. And that highlighted some of the things that we knew already, but this really did consolidate it. So children who've had and young people who've had kidney disease as a child and were now transplanted or on dialysis were less likely to be in a relationship. They were less likely to have children of their own. They were more likely to be still at home living with their parents, more likely to not have a job despite reaching the same educational level of attainment. They've reported their own quality of life to be worse. They had more mental health issues. And the one positive that people came out with was that they were less likely to be smoking, drinking, or taking drugs, gambling, or involved in crime. And that sounds like a good thing. But actually, in some extent, those are normal young adult things to be doing. And it does suggest that these young people are not getting the same opportunities, good and bad opportunities, to partake in things that their peers are doing. Next slide. And thinking more challenges of kidney disease in children, fatigue, really hard to measure, can be significant. Again, particularly teenagers. Everyone who's got a teenager knows that they sleep for approximately 21 hours a day and are only awake between the hours of 10 p.m. and 1 a.m. So they're constantly tired, and how you tease out tiredness of kidney disease and tiredness of being a teenager can be very difficult. And that impacts on everything in life. You're tired at home, you're tired at school. Boys want to kick a football about. That's all boys like to do. And if you're tired and can't manage to kick a ball about for more than 10 minutes, that impacts on your life. I already mentioned that increasingly there are children who are surviving that may not have survived 30, 40 years ago, and these come with their own challenges. We have moved from being nephrologists who look after children with pure kidney disease to having to coordinate with several other services, and that comes with its own issues, as many of our families have experienced. And then teenagers, I've joked about them, and I'm sure that Zach, as a teenager, will be telling us that everything I say is lies, and they're not like that at all. But adolescents are difficult to look after. They want to rebel, and that is understandable, and they don't like to be told what to do, and that is understandable. But we recognize that adolescence is a really high risk time, and the graphs on the right are just a demonstration. So it's just showing your risk of losing your kidney graft if you've had a transplant. And what you see is that risk is really quite low when you're age 6 to 9. And then when you get to 12, that number starts to jump up. And when you're in your early 20s, that number is very high. And we know that young adults lose their kidney transplant. And that happens, or much higher risk to lose their kidney transplant, because they are doing things that normal young adults do. They're going out and drinking and forgetting to take their medicines. They don't want to take their medicines because it's the one thing they have control over, and they use that as a battle. They're distracted by being out with their pals, and it's very rarely a malicious, I'm going to do this to prove that I don't need this. It's teenagers being teenagers. But unfortunately, the only response to being a teenager is to grow up and not be a teenager anymore. But what that graph shows you is actually there's plenty of people aged 24, 25, 26 who are still teenagers. And we recognize now that brain development, in terms of the frontal lobes that really get you to grips with the consequences of your actions, probably aren't fully developed until you are 27, 28, 29, which means that my junior doctors on the ward are just as likely to do daft things as my teenage patients. And I hear about that most Monday mornings. Next slide, please. So that all sounds very bleak. And as I was writing, I thought, this sounds terrible. Everyone's going to go away devastated and depressed. But actually, I love my job. And I love working with children with young people with kidney disease. They are robust. You can put these kids through the absolute mill, and they just bounce back and are grateful for everything that you do, and their ability to just cope with the stuff that gets thrown at them never fails to amaze me. This is done in coordination with Living Donation, and so I'd be remiss to not talk about transplant. We are very fortunate in paediatrics that there is often one or two really quite closely related donors available. Parents are often very, very keen to donate, and understandably devastated for the reasons that mean that can't happen. Children do still have something of an advantage on the waiting list for deceased donor transplants, although the absolute priority for children is no longer present, and we still very much encourage living donation to be the preferred option. And thankfully, my job is, as one of 7, there still is no need for huge numbers of me. Significant kidney disease in children remains rare, and that is something that I am constantly grateful for. And that's me.
That's fantastic. Thank you so much, Ben. That's a really, yeah. I think one thing about doing these webinars is no matter how long you've worked somewhere, there's always things to learn, and that was a lovely talk. Thank you very much. We're going to keep some question and answers to the end, if that's okay with everybody. And so there's the chat bar. If you want to put some questions in there for Ben at the end, then we can share these questions then. So I'm going to move on now to the role of the Scottish Advocacy Officers, and we're delighted that Lynn Cunningham will join us. Liz Doherty may be able to join us. Lynn, have we heard?
I don't think it's going to happen, Liz.
It's not going to happen. So Lynn is going to do this, and I think this is hugely important, really, for us all to know exactly, all the support and the help that advocacy officers from Kidney Care UK can give. So I'm looking forward very much to hearing what Lynn has to say. Thank you.
Hi, good evening. Thanks, Jane, for the introduction. Hi, I'm the real Lynn Cunningham. I'm one of the 3 advocacy officers in Scotland. My colleagues, Ewan McLean and Liz Doherty, cover the west of Scotland, and roughly speaking, I cover the east. As support and advocacy officers, we're here for patients, carers, parents, family members, for a whole range of services. But what I wanted to do this evening was to let you know about some of the services that might particularly relate to you if you're a younger person. Sometimes I think our service can be seen as something for an older person, or kind of akin to that of a social worker, and some people don't want a social worker. So I just wanted to talk through a few examples of help that might be of interest to you. And then I was going to hand over to Liz, who was going to speak with a patient who she's been dealing with recently around employment, but I'll just continue on and do that as best as I can. We've just had some joining issues tonight. So you'll see from this slide here that there's a whole range of services that we do offer as advocacy officers, and I'm not going to go through them all. But what I would say is if I don't know the answer to a question, then I have another 13 colleagues that I can ask. If we don't know the answer collectively, we will try and find out. And if we can't find out, and it's not relevant to us to find out, then we will always signpost you on to those that can. All our AOs, advocacy officers, have a range of knowledge and experience. Some are patients, some are carers, some are from the NHS and have worked in the renal world for quite a long time before joining Kidney Care. I've been with Kidney Care for 3 years, and my own personal reason for joining Kidney Care was that my mum was a patient for most of my life. I was there when she was on dialysis, home dialysis, in-centre dialysis, and she had 2 transplants. And I would never say that I have personal knowledge of being a kidney patient, because obviously I don't, but I do have knowledge of chronic kidney disease seen through my mum. So I wanted to speak to you about some of our main services. Grants is something that we are known for. And if you call our head office, you'll usually be put in touch with your local advocacy officer. And that's not because grant head office can't help you with the grant. It's in case there's other issues or other help that we can give you. And we only find out about that by firstly speaking about the grant and dealing with that, but then having a chat and see if there's anything else that we can help you with. And because we're local to your area, I say, and I might sometimes be semi-local given the geography of Scotland, but we can be more aware of the services that we can offer you. With grants, yes, we do cookers, washing machines, televisions, that type of thing, and if they break down in somebody's house. But they can also apply to you if you're moving into a new flat, if you've just moved out of home, if unfortunately you've come out of a relationship and you're having to move into some place. We can look at these things for you. It's not just if they've broken down within a household. But particularly as a young person, consider things like driving lessons. If you can drive, it gives you freedom, you're not reliant on others, and it could be that it could open up a job opportunity for you. If you want to go to college but can't afford the computer, that could be something that we could look at, as well as maybe books, safety equipment, if you need those to start the course. With regards to young people, we can look at things like prams. If you need a second pram, say, because your pram is too heavy, or you've got parents looking after you, you need a small buggy for a car, that type of thing. If you find yourself unable to work in the job that you're in and you're looking to retrain, that's something else that we would consider. Another thing that we also look at is, are you trying to keep fit to stay on the transplant list, or lose weight, get fit to get onto the transplant list? And we can look at some sports equipment for you in order for you to get there. That's just a few examples of grants, just to think sort of outside the box sort of thing. There's no specific list for our grants. All things will be considered on their own merits, but we don't pay off debts, we don't pay off credit cards, and we don't fund dialysis transport. But what we do is, if you are lucky enough, say, to be transplanted, obviously you'll be down at Edinburgh or Glasgow, because they're the only two transplant centres in Scotland. Now, if you happen to live in the Western Isles, or you're down in Dumfries or something like that, transportation could be quite costly, and that's something that we could help with. With regards, say that you're thinking about going to college, do you feel comfortable going to that interview for your course on your own? Now, I'm speaking obviously about pre-COVID times. We would be able to attend that interview with you. At present, we might be able to attend on a Zoom, or maybe have a chat with you beforehand, you know, something like that. How soon we'll be able to do these things in person, obviously, again, I don't know. But we're able to, say, give a college information about chronic kidney disease, how it might affect your class attendance, your study, and what support they could help put in place for you. If you were going to need parking at the college, for example, I was thinking of our own college today at Perth, where I stay, and the walk from the car park up to the college is such a steep hill, and that's something that we could support with a letter, make sure that you've got the right access, etc. A colleague recently down south told me that, along with occupational health, she'd been successful in getting a made-to-measure chair for a student, because the chairs were too uncomfortable for her to sit in for any length of time. With housing, halls of residence, we can offer a support letter to make sure somebody can maybe access ground floor accommodation. We can support housing applications in general, and we can also approach medical staff for you for these additional support letters if you're not comfortable doing it yourself. Now, I'm saying college with that, but all these things also would transfer into the workplace. We're not employment experts, but we will signpost if necessary. And we're aware of your rights under the Equalities Act 2010 and can speak in general terms. And I'll speak about that a bit later on with Hayleigh. Another thing that we tend to spend quite a lot of time on with people is benefits. Now, we have a partner agency called Auriga, who will go in depth with you with all benefits, what you're entitled to, what you're not. And that's quite a complex issue, and I would never say that I know about universal credit and all these different things, but what we tend to have more of a knowledge of are the ones that are more personal to patients, such as disability, living allowance and PIP. We can help with these benefits from start to finish. We can attend your assessment, we can help you fill in your form, we can take it to mandatory reconsideration and tribunal. Don't be put off by stories that you hear about people not getting the benefit. It is hard to do, but we can help with that. The form's long, and sometimes an assessor appears not to have any knowledge of chronic kidney disease, but it is worthwhile, and it's something that we're here for. These benefits are actually devolving to Scotland next year. In fact, disability living allowance, people may know already, has actually devolved and is now called child disability payment. It just came completely live here this month, and adult disability payment rolls out from spring next year. We will still be able to help as advocacy officers on for both these benefits. There apparently is an advocacy service that is going to be attached to Social Security Scotland, but we'll be happy to work with them and to work with you. Excuse me a second. For these benefits, and hopefully, the only thing I'm going to say about them now is, if everything in the consultation is true, then hopefully in Scotland we are going to be you as patients will be getting dealt with a lot better on these benefits. That's really the main things that I want to say to you about our service. It's open-ended, really. We tackle new issues every day. You might have an issue with transport, with COVID concerns. I've spoken to a couple of people lately who've not been on the list for their third dose and managed to get that sorted out. You might want to discuss treatment options with somebody out with your family, or you may just want a friendly ear and somebody to talk to. And that's absolutely fine. We are here for all these things. We also appreciate that you may want just the practical help from us, but prefer a listening ear from somebody more your age, and we're not offended by that. And Holly from the young adult group is going to talk more about the service that they can offer later. But what I would say is, it doesn't matter if you think your issue is big or small. If it matters to you, then it matters to us, and we'll do our best to help you with it. And at this point, I would like to bring in Hayleigh, and I would like to go through what she's been experiencing lately with her employment. Hello, Hayleigh.
Hi.
Hi, Hayleigh. Now, we've never met before, unfortunately. This is our first time talking, but what I would like to do is just go through with your story and the help that Liz has given you recently with your employment. So maybe you could just let us know how you came to dialysis and how things have evolved recently for you.
Yeah, so I got kidney disease when I was like 12, I think. So it was IgA nephropathy that I had, and they did say that it would eventually lead to kidney failure, and it just kind of happened quite fast, to be honest. They said that my kidney function had went down, maybe it was like September, and then within a month I was on dialysis straight away. So when I was in the dialysis centre, it was one of the nurses that had gave me the Kidney Care UK number, and told me to phone. So what had happened is, at my work, I worked full time, and because it happened so quick, they'd put me onto statutory sick pay straight away, and they weren't really helpful, to be honest. So then when I got in contact with Liz, they had asked me if I wanted to get made redundant, because I couldn't come back to work straight away. So when I called Liz, it was her that said, like, don't accept the redundancy, and she kind of helped me and told me like what the laws were, and that obviously they weren't allowed to do that to me. So she also gave me the information about the grant as well. So I got a grant as well from Kidney Care UK. So that was just kind of to help with like my mortgage payments and stuff, my car, everything that I still had to pay, even though I wasn't at work. I did go back to work full time. When was it, like 2 weeks ago? So I'm back at work now, but I kind of only really went back to work because I had to.
Okay.
But yeah, so if it wasn't really for Kidney Care UK, I would probably have been redundant, because I wouldn't have knew any better not to accept it.
Right, that's really good to hear. I think, if I'm right, Liz had offered to speak to your employers?
Yeah, so she said about getting a meeting set up, and she would come with me to it. So she really gave me a lot of help, but it's just that it didn't get to that far. So she gave me all the help that I needed, but it ended up that my work were okay with me going back. At first they were saying I wasn't allowed to come back because I was too unwell, and then they eventually let me come back.
Right. So your employer wasn't fully aware of maybe what kidney disease was and how it was going to affect your ability to be able to do your job?
Yeah, pretty much.
And I think the information that you gave them from having contacted us made you able to have a discussion with them, and you had some reasonable adjustments made in order for you to return to work.
So what it was is because my dialysis days was the days that I was meant to be in work as well. So I was going to work from the dialysis centre, but my work were like, we're not really happy with you doing the job while you're on dialysis. My job is a little bit stressful as well, so I understand where they're coming from. So we managed to like work my hours different times so that I'm not working at all when I'm at dialysis.
Right, okay, great. So if you hadn't had, so in essence, the nurses being able to give out our information have helped you to keep in work.
Yeah.
Yeah, that's great. Well, thank you very much for coming on just now and sharing your story.
No, you're welcome. I would love to stay for the rest of it, but actually I have to go and put my wee girl to bed. I was only really coming on just to do this quickly.
Yeah, I understand. I didn't have that much time.
No, it's fine.
Very much.
Okay, thank you.
Thank you.
Bye.
Bye. Thanks, Jane.
Thank you so much. Hayleigh, I hope you're still with us, just to say, that I think that's such an important message to hear, and also for all the members of staff to hear as well, that just, how important it is, for patient support to pass on the Kidney Care UK details and impact that it can have. Lynn, thank you very much for a really interesting, informative talk. That was brilliant. Thank you. And we'll have questions at the end. And we're going to move on now to my colleague, Julie Glenn. Julie is a Living Donor Coordinator in Glasgow, and we're delighted that Zach Khan has agreed to join us as well. Zach is 18 and is going to share his experience, have a chat with Julie about what it was like to be a young kidney patient and the transplant process. So I'll hand over now to Julie and Zach. Thank you.
Hi everybody. Hi Zach. I was just wondering, Zach, if you could maybe just start off by telling us when you first knew there was something wrong with your kidneys. What age were you and how did that make you feel?
Yeah, it was quite a fast process. I was still in school and I was just kind of feeling genuinely unwell. And I was just feeling unwell and stuff, and I went to the children's hospital, went to A&E, and got blood tested and stuff like that, and then I kind of got told that day that I've had kidney failure and I've also had it for the past 2 years. And then since I got that news, it was very fast. I mean, I got that news on the 13th of December 2017, and the next day afterwards I had got my central line put in. And then the next day after, I was on my first dialysis session. It was all very fast.
So you must have really not had any time to process any of that before suddenly your life had changed massively.
Yeah, it was a big change. It was quite fast. I didn't really kind of understand what was happening. And I got told I had kidney failure. I didn't really know anything about it until I looked at my mum's face and I seen how bad she was, and I thought something's wrong here, but I didn't really know what had happened while I was on dialysis and stuff. I didn't really know much about anything. I was just kind of taking the day by the day, and it was quite a horrific experience.
You would have been at school at that time, Zach. Did you have to miss quite a lot of school in those days when you know, just at the beginning?
Yeah, I missed a lot of school in the beginning and throughout dialysis as well. I've missed a huge chunk of school, and it's put a big effect on my education. And it's yes, it was not good. But I missed out a lot of school and stuff, and I just tried my best to kind of get back to where I can.
Yeah. And did you find it easy? I mean, I presume you would have then found out about transplantation as part of your journey. Did people talk to you about that straight away when you were first found yourself suddenly on a dialysis machine, or was it a wee bit of time before, you know, before everything sort of stabilized with you, before people started to chat to you about transplantation?
I would say it was a wee while into it before we kind of talked about transplants and stuff. I think at the start it was more just the doctors and everyone kind of telling me what condition I have and me getting used to what if I'm on dialysis, because it was quite a sudden change in my life. So yeah, transplant wasn't really a talk at the beginning. Obviously later on it was a big talk and just trying to get myself a kidney.
Yeah. And tell me a little bit about that journey, Zach, because you had some potential living donors, didn't you? Family members had come forward. How did that come about? Did you have to have those conversations with them, or were you inundated with offers? Or
yeah, I would. I mean, when it came to kind of me getting transplants, it was I had like those two people that were kind of lined up. There was one of my brothers and my dad. But obviously, when you're trying to give a kidney to someone, you need to make sure you're 100% healthy and nothing's wrong with you. But unfortunately, when it came to my family getting tested, there was always kind of some problem with giving me the kidney, because obviously the doctors wanted to give me a kidney that would be very good for me. So yeah, it was just kind of that we were just trying to find myself a kidney. And I got told as well that it would be quite hard for myself to get a kidney from a kind of like random person. It would be much easier for me to get it from a family member. So yeah, I was just kind of trying my hardest to get it from somebody in my family.
so that must have been quite an emotional roller coaster for you and your family, given that you had donors who then couldn't proceed. Were you able to ever chat to any of your friends about this? I mean, you must have had a lot to deal with as a young man.
Yeah, it was a lot, but I would say that, I mean, like, I am a quite a private person. Like, I don't like to discuss a lot with people. Like, I mean, the only person I would discuss everything would be is with my mum. I would tell her everything, but regarding stuff that how I'm feeling or whatnot, I would kind of just keep it to myself and my mum. And yeah, it was an emotional roller coaster for me and for my parents and everything, because I was quite young, and it was just kind of hard getting used to that life.
And of course, your story changed when you got a phone call, didn't it? So tell us a little bit how you felt. Was it in the middle of the night, as these phone calls often are, or was it during the day?
Yeah, so I was during the night. I can't remember what time. I think it was maybe 4 or 5.
Yeah.
But I was it was Dr. Reynolds that phoned my mum and told my mum that there's a kidney there for me. And my mum kind of told me. I was in shock. I was shaking and stuff. I didn't believe it that it actually happened. And mum kind of said, "Oh, you need to go get ready and go to hospital." And then obviously at that time it was the pandemic and everyone was on lockdown and stuff. So I had second guessed it for a second and thought, wait, I don't want to do this because I don't want to end up with COVID. But I kind of just weighed the pros and the cons and thought, you know, I can get another chance at a better life here and just need to take it. And yeah, I was like, I could see I was nearly crying when I got the news that I was going to get a transplant, because it was a hard life to live.
I bet your mum was crying. And so how long were you in hospital for, Zach?
I was on dialysis for 2.5 years. I was going three days a week, maybe sometimes 4, just kind of depends. I was trying to kind of, obviously I was on dialysis in the hospital. I did try and get home dialysis. That kind of lasted as well for about a couple of months, but a bad event had happened and that kind of just went out the picture. But yeah, 2.5 years I was kind of in hospital all the time, which is why I couldn't really go to school much or kind of socialize with friends or anything, because that was like my second home.
And when you got your transplant, you obviously went through an operation first of all, but then did you spend quite a bit of time in hospital after that? How was your recovery from that?
Yeah, I thought my recovery was okay. To be honest, I remember kind of getting my transplant on like it was in 2nd of May, and I got my transplant last year. So I think it was about a month or something. I was in hospital, but you know, it was probably like the happiest I've ever been actually lying in a hospital, because I've got a new kidney and I was, you know, getting back to healthy. And you know, like even remember Ben had said that your taste buds and everything changes about you, and I realized that straight away.
That's great. And did you feel like you gained energy and all of that straight away, even when you were still in hospital?
Yeah, 100%. When on dialysis, I was always like quite fatigued and tired, and I couldn't do a lot. But I mean, when I had the transplant, I wanted to walk around the ward and go and do this and do that, and I just had so much energy, and it was a very good moment.
And how, if you could sum it up, you're now just about a year and a half after your transplant. So if you can just tell us what that means to you, what difference has it made to you? What things are you doing now with your life that you maybe couldn't have done if you were still on dialysis, Zach?
I mean, first of all, I would say that I'm very grateful that I've got this kidney. It's completely changed my whole life. It's changed the aspect of looking at life. And when you go through such a horrific time, you just appreciate the little things in life that you're able to do, like spend time with friends, family, you know, kind of not going to hospital a lot, you know, even eating a range of foods that you can eat. So I would say that I'm very grateful for getting this kidney. It's changed my life. Ever since I kind of got the kidney, I'd missed a lot of school while on dialysis, so I tried to kind of get back into my education. I'm in college now, so I'm trying to kind of pursue that. I mean, health-wise and stuff, before, like on dialysis and stuff, you couldn't really play football or do anything, but now I'm kind of doing my football, playing boxing, and going gym. I'm doing all the stuff I want to do. I'm living like a happy life, I could say.
That's fantastic, and it's so nice to hear you sharing it from the heart, because that's really what the important thing is here. It's you know, it's your words are better than anything that Jen or I or anybody else could say. So thank you very much.
No, it was an absolute pleasure coming on and speaking to everyone.
Oh, Zach, that was fantastic. Thank you so much. You know, and I think everybody here listening to you just really appreciates. I think as Dr. Ellen said, you know, just going through all what you went through, and here you are, and you know, just speaking so well about it. Thank you so much, and thank you, Julie, for being a great host for the session. Thank you. I'm now going to move on. Our time is moving on quickly, so we're just going to move to Holly Lawton, who I'm delighted. She is a kidney transplant recipient and she runs the Young Adult Kidney Group. So I'm going to pass over to Holly just now. Thank you, Holly.
Hi, thank you everybody for having me tonight. My name is Holly Lawton. As Jen's just said, I'm a kidney transplant recipient and part of leading the Young Adult Kidney Group. The Young Adult Kidney Group is an amazing peer support-led support group, patient-led peer support group rather, for young adult kidney patients in between the ages of 18 to 30. We started initially in 2016 with about 30 members, And in the last 5 years, we have grown and grown and grown into an incredible community of now over 700 members worldwide, most of us based in the UK. And we have been running in partnership with Kidney Care UK for the last 2 and a bit years. As I've said, we are a patient-led peer support group for young adult kidney patients, and we're very unique in the fact that we are specifically for patients only. We don't allow any family members, friends, healthcare professionals, or anyone else to join our closed Facebook group, simply just because of the fact that we really understand the value of our group being a real safe space for young people with kidney disease to join and to be able to not only meet and chat with other young adult patients, but also to discuss the topics that might be slightly sensitive or private or personal that they maybe wouldn't want to ask their medical team or their healthy friends or their family members. They just want to be able to have an environment to talk about it with other people who are in the same situation and who understand what it's like to be a young person living with kidney disease. At the moment, our group is led by a team of 12 trained peer supporters. All of us are kidney patients ourselves. Some of us are transplant recipients, dialysis patients, late-stage kidney disease patients. And we all really recognise the value of what having a real community of other people who understand what it's like to be a young person with kidney disease can bring. And we want to use the knowledge and skills that we've gained through having to navigate our lives, I suppose, with kidney disease as part of them, to help other people to understand that, you know, there is hope and there are things that you can go on and do, and that you can you're still yourself. You're not just your diagnosis, you're still you. And I think, as a couple of the previous speakers have said, that's something that young people with kidney disease sometimes really struggle with, is feeling like they're the only one. And I know that I really found that difficult myself when I was in the situation of, you know, being in an outpatient clinic waiting room or admitted to a hospital ward and being in my mid-20s, late 20s at the time, and looking around and seeing that I was surrounded by people 20, 30, 40 years older than I was, you know, feeling really like, why am I here? Am I the only young person dealing with this? I felt so isolated and just, you know, like I didn't really have anybody to talk to about the things that I was struggling with. So that's a big part of why our young adult kidney group is so important. Alongside having our peer support team, we also work really closely with Kidney Care UK to make sure that our members are able to access the support that they can provide in terms of access to advocacy officers, counselling team, medical advice, particularly in the last 2 years with obviously COVID restrictions affecting our group, and then again obviously leading into, you know, that feeling of being different from your healthy peers in terms of having to shield, being deemed clinically extremely vulnerable, really feeling like you're very, very different. So I think again that's where our group has really kind of come into its own and filled a real gap and filled a real need. At the moment, we are just wondering whether we are going to be able to plan for next year what we have been doing in the last couple of years pre-COVID, which is hosting, in conjunction with Kidney Care UK, an annual residential trip away to the Peak District. And that's something that we try and host every year when we can meet in person. An opportunity for members of our group to come together and actually spend time face to face with other people in similar situations. And I've been attending these weekends for several years now, firstly as a participant and then more recently as a peer supporter. And I think unless you've attended something like this, it's kind of hard to really describe what it's like to be in an environment where everybody gets it, even if it's somebody you've never met before or you've only ever spoken to them online. You go there and you know that there is that commonality of being a kidney patient, of being on dialysis, of having had a transplant, that, you know, real mutual understanding of really getting what it's like to have to go through kidney disease as a young adult. On the screen at the moment are our contact details. As I've said already, our Facebook group is closed, which means it's only for kidney patients themselves. But our website, our Twitter profile, and our email address are there as well. And we really welcome anybody that wants to get in contact with us to find out more information about what we can offer, how we can help. So yeah, I really would encourage any clinicians on this webinar, professionals, patients, family members who think that someone you know or even you yourself could benefit from being connected to our community to get in contact with us, because we'd love to include you. Thank you.
Holly, thank you so much. It's very inspirational to hear you speaking about all what you do. I think such a valuable resource for all young people with kidney disease. So thank you very much, and thank you for sharing your details. We have 2 minutes left for questions. I'm just going to ask Ben. Orla has asked if a donor is fit enough to donate but is incompatible with the recipient. Now we know what happens in the adult world here. What happens with children when they have 1 or 2 or 3 donors who all wish to donate but are incompatible? Do you use the kidney sharing scheme as much?
So we're certainly open to using the National Kidney Sharing Scheme. So I again, in my alias of Lynn Cunningham, I briefly answered the question. I realised with both myself and Lynn being on the chat, it is difficult. I mentioned the sharing scheme whereby, so you have let's say a dad who is wanting to give a kidney to you, and then down in, I always choose Southampton as an example, down in Southampton there's a husband and a wife, and the wife has got kidney disease and the husband wants to give the kidney, but the husband's not a match for the wife, and your dad is not a match for you for blood group reasons, for example, but is a good match, but is a good kidney donor otherwise. So then your dad gives the kidney to this man's wife down in Southampton, and the man in Southampton gives his kidney to you. So you have this direct swap of kidneys, which is what the National Kidney Sharing Scheme is all about. We have not yet in Glasgow had a child receive a kidney on the sharing scheme. That is more because we've put a few children into the sharing scheme and we're very happy to use it. The children we've put in, the first time they've had a run, they haven't had a successful match. And as you know, Jen, often one of the requirements for being on the sharing scheme is that you are also on the waiting list for a deceased donor kidney. So all the children that we've said would take a shared scheme kidney from have then been offered a kidney from a deceased donor and have not gone on to have a second run. We have got, I think off the top of my head, 3 children and young people pairs that we're hoping to put into the shared scheme at the beginning of next year. So it's something we're using more and more. And certainly the shared scheme has been used by other pediatric transplant centres across the UK. So absolutely, we hope to use it soon as well.
Good. And do you have an age criteria depending on the age of the child? I think
No,
people always want to know kind of.
No, there's no specific age criteria in terms of who donors that can go in. There is an age criteria, and there's not really an age criteria in terms of doing a transplant on a child. You just need to be, they need to be long enough to be able to squeeze an adult kidney in. And sometimes there are little factors in that. So if you are a 6'7" man, you probably are going to have a bigger kidney, and it would be hard to fit that into a smaller child. And I honestly, off the top of my head, I don't know if the paired exchange scheme includes that piece of information. So it might be that you would go into it and then find out actually your donor has a massive kidney and it couldn't happen because you couldn't physically fit it in. But there's no age criteria on entering a donor recipient pair in at all.
Lovely, that's great. Thank you so much. Thank you. And we've got a question for Zach. Any top tips for young people to keep on top of their medications?
I mean, you could do what I do. I just kind of set alarms on my phone for when I need to take my tablets, and that kind of just helps me because it's kind of blaring in your ear to just like take your tablets and stuff like that. It is quite hard to take tablets as a teenager, but you just have to do it because it's important.
Yeah, that's great. That's the attitude that we really support. Thank you so much. So we're now at 7:30. I would just like to thank all the speakers so much. It's been a fantastic session. I'm sure everybody has learned a huge amount. I certainly have. And this webinar has been recorded, so it's going to be available on the Kidney Care UK website. We'll be sending you a follow-up questionnaire by email, which we'd really appreciate if you could complete, because we gained really useful information for our next set of webinars. And I'd just like to thank Kidney Care UK again for all their support in running these webinars. So thank you very much.